All right, thanks so much, everybody, for coming out today. We really appreciate everyone in attendance coming out to support the release of Our Stores, Our Future, a report from Alcohol Justice and the Santa Fe Alcohol and Drug Coalition. And great. Thanks so much. And we're so delighted to have great guest speakers and a youth speaker from Youth for Justice. We're going to begin today with one of the authors of the report, our research manager, Carson Benowitz Fredericks. So here we go. Thank you, Carson.
All right. Thank you, Yavar. And thank you, everybody, for coming out here. I am the research director for Alcohol Justice. And I'm here to ask you a simple question that has a lot of difficult, a lot of complex answers. And it's, what is normal? Is it normal to want to go to the store and buy a bag of chips? To go to the store and want to buy a soda? Is it normal to go out and buy a can of beer? A can of hard seltzer? Is it normal to go out and do these things if you're in your 40s? What about if you're 25? Or what about if you're 14? I'm asking this question because Marin, healthy, outdoorsy, organic-friendly Marin County, is well above the state average for underage drinking. 40% of Marin County high school juniors drank in the past month. The state average is 23%. 1 in 4 Marin high school juniors went out binge drinking in the past month. That's twice the state average. Nearly 1 in 5, 20% of juniors drank multiple days in the past month. The state average for that, 8%. And that's a problem. It's a problem that becomes reflected in the short term in youth mortality. We know that alcohol is implicated in the 3 leading preventable causes of death in adolescence, including motor vehicle crashes. But it's also reflected in longer term problems. The earlier someone starts drinking, the more likely they are to engage in harmful drinking practices when they're older. This obviously means they're also likely to buy more alcohol over their lifetime. But from the perspective of the big alcohol industry, encouraging underage drinking, making it normal, is good business sense. And we see this the way youth respond to alcohol advertising. Research shows that the more ads kids see, the more likely they are to start drinking, the less likely they are to look down on peers who drink, and the more likely they are to engage in binge drinking, heavy drinking, and repeated drinking patterns. That is to say, the more ads they see, the more normal drinking as a young person seems. While TV and social media are the high-profile outlets for advertising, in truth, the industry spends nearly 50% of its multi-billion-dollar marketing budget on out-of-home ads, including the ones inside stores, on store shelves, and in store windows. Studies asking kids where they see alcohol ads show that outdoor ads account for 47% of the ads they report seeing. That's much more than on TV. It is functionally impossible to go get chips, to go get sodas, in some cases to simply walk home without being flooded with these ads. Now, California has something called the Lee Law. Lee Law mandates that no more than 33% of store windows be covered in ads, but it is not always enforced, and it may not be sufficient to roll back the normalization of drinking among Marin adolescents. This is further exacerbated by the kind of products the industry likes to move. Alcohol tastes bad. We know this. So young drinkers are more likely to be drawn in by heavily flavored products. Alka-Pops, hard seltzers, cocktails in a can, BuzzBalls, etc., etc. These products have exploded on shelves recently. 2/3 of underage drinkers report consuming these products. They are the product you go to if you are a new drinker. Now, Alcohol Justice is dedicated to preventing the harms from alcohol, both in our country and in our community and throughout the country. Now, with this in mind, we went out and looked at stores that sell alcohol for takeaway in San Rafael. We want to know, what were the risk factors that promote underage consumption? What could be done to change them? What would a protective new normal look like in this city? We looked at 44 outlets throughout the city and rated them for risk factors. The full breakdown is available in our report, Our Stores, Our Future. It's got the purple cover. But here's some of the highlights, or lowlights, if you will. 54% of all stores surveyed had alcohol advertising. 32% of them were out of compliance with the Lee Law. That is, had more than 33% of their windows covered in advertisements. Sometimes the entire outside window surface was covered. 61% sold two or more high-risk products, including Alka-Pops. Nearly every single store we looked at sold hard seltzer, but most go further to stock other heavily flavored products. And of the stores that showed the most risky practices, that scored the highest in terms of overall risk, the majority of them were within 1 mile of San Rafael High School. And this is concerning. If Marin wants to bring rates of youth drinking down to just even the state mean, something has to be done. Alcohol Justice has put together a series of best practices guidelines for any alcohol retailers that want to be good citizens, that want to respect the role they play in normalizing drinking among youth or preventing it. These best practices are listed over to my side here. They're included in the report, along with a detailed explanation of what makes a risky store and which stores in this town are most in need of change. Now, the requests we are making in these best practices, they're not strange. They're not elaborate. You might even say they are very, very normal. Thank you.
Thank you, Carson. And now we'll go to our next speaker, Jeffrey Angeles. He is the co-chair of the San Rafael Alcohol and Drug Coalition and a member of Youth for Justice.
Hello, my name is Jeffrey Angeles. I am the co-chair of the San Rafael Alcohol and Drug Coalition and a member of Youth for Justice. Together, we are working to save the youth in our community from the harms of alcohol and dangerous retail practices. Our grassroots solution to the underage drinking problem and the dangerous behavior of alcohol retailers in San Rafael is our youth-led campaign, Youth Action for Safe Stores. With this campaign, we want to remove the youth-targeted products that stores carry in the excessive way alcohol is advertised. Our goal is to make San Rafael a safe retail environment for youth and to reduce the influences that led to underage drinking. One part of our campaign is working with the City Council to pass a resolution in support of Youth Action for Safe Stores. We are glad to have Councilmember Yuran Scolate here with us today. With the support of the City Council, we will then engage with local stores as part of our effort to change their behavior. We will contact store owners to educate them on the harmful influences of alcohol advertising products on youth. We will also show them how they can change their behavior to become safe stores in our community. As we work to achieve our campaign goals, we appreciate the support of Councilmember Yuran Scolate and Dr. J. Africa for seeing the importance of our work supporting us in our efforts. Thank you.
Great job, Jeffrey. Thanks so much. And our next speaker is Dr. J. Africa, the Director of Behavioral Health and Recovery Services at Marin Health and Human Services.
You're far enough from me so I can take off my mask. So good afternoon, everybody. It's really a pleasure to join you all today to support the Our Stores, Our Future report and the Youth Action for Safe Stores campaign to change the alcohol retail environment in San Rafael. In Marin, 9th and 11th grade students are drinking at higher rates than the statewide average. Aggregated data from the California Healthy Kids survey from 2017 to 2019 reveals that 49% of Marin's 11th graders reported they have used alcohol or drugs in the past 30 days, more than double the statewide average of 23% for 11th graders. Additionally, the reported substance use rate among 9th graders in Marin is 25%, much higher than the statewide average of 15% for that age group. The issue of underage drinking in San Rafael is at the intersection of public health and social justice, as the large population of low-income Latinx youth in this city are disproportionately affected by alcohol advertisement and normalization. 25.7% of youth under 18 in Marin are Latinx, of which majority reside in San Rafael. In addition, Latinx Black youth are more likely to face punitive consequences for drinking, such as suspensions, expulsions, or DUIs, than their white counterparts. We in Health and Human Services, specifically in substance abuse prevention, has made it a priority to engage disadvantaged populations most impacted by health inequities. We are committed to implement evidence-based prevention strategies to address underage alcohol use through education, social media campaigns, and ensuring current laws regarding supplying alcohol to minors are enforced. Let me reiterate some facts. Early intervention prevent later problems. Age of initiation affects severity of use later in life. Environmental protection and alcohol works. Advocating for policy change, organizing, and enforcement works. Thank you to Alcohol Justice. Thank you to the young leaders who are part of the Youth Action for Safe Stores campaign. Thank you for helping advocate for a healthier community. Thanks so much.
Thank you so much, Dr. Africa. And now we will go to our next speaker, Syra Soriano, a representative of the Tobacco Control Program of the county. Thank you, Syra.
Hello, good evening. On behalf of Bay Area Community Resources, a nonprofit here in the Bay Area, and the Marin County Tobacco Control Program, we want to express our appreciation and support to Alcohol Justice for all the amazing work that they do in this county, as they continually demonstrate their commitment to protect and improve the health and safety of the Latinx community here in San Rafael. We believe that their Our Stores, Our Future report provides valuable information on the issues and the need for change in the retail environment. The rates of underage drinking and other harmful behaviors, including smoking and consumption of unhealthy foods, can decrease with less promotion and exposure to youth. We're delighted to see the youth efforts through the Youth Action for Safe Stores campaign. The youth in this underserved community are aware of the harms that the current retailing practices have on them and on their peers, and we should listen to their concerns. The best practices for stores that sell alcohol recommended in this report can improve the safety of not just the community, but of our community store owners as well. An example of this is the improved safety that the Lee Law provides, which Carson, Research Director, had mentioned earlier. This law limits the amount of physical sign coverage of store windows and doors so that law enforcement can help protect stores from any potential crime or disturbance occurring indoors. While San Rafael allows less than the state Lee Law mandate percentage, our program recommends a limitation of 15%. This report is helpful and should be considered as it clearly aims to decrease the negative impact of industries that place profit above safety and health. Thank you.